Hello, everybody, and welcome to another episode of Dentistry Beyond the Numbers. My name is Dr. Marc Liechtung, and we are so lucky to have one of the really shining personalities, bubbly personalities in dentistry, and that is Dr. Elaine Bylis. Dr. Bylis is from Maryland, Glen Burnie, Maryland, right? Glen Burnie, Maryland. So I want to just read something because this is really interesting to me. You finished Magna Cum Laude of Neurophysiology at the University of Maryland. So first thing comes to mind, she earns a DDS degree at University of Maryland, good school. She has advanced training in cosmetic dentistry under the Ross Nash Institute.
Yep.
Right? And she is a guest lecturer there. We had somebody on just the other day who's a guest lecturer, Anthony Vocatoro, a good friend of mine. And since that episode, I referred him a couple of really great cases. So good for Anthony. And he thanked me for each one of them. She has been inducted into the International Academy of Dental Facial Aesthetics, something I'm very proud to be in. Dr. Hexter and Dr. George Friedman. Is that the one?
I don't know.
We'll get into that.
Yeah, well,
Featured one of the 2024 Benco Dental 40 under 40 top dentists in the country. And we are competing on the short list here in Portland for the Denobi Awards. I'd vote for her. But there we go. So the biggest thing that the number one thing that attracted me to you to be on the podcast was the ability for you to go into a family practice, to really, seems like you're loving life and loving your profession, and also talk about a succession plan. So we're going to get into that. I think it's really important, and you're somebody who really knows a lot about dentistry and somebody who knows a lot of people in dentistry. And I think it's very important to get your perspective. So first of all, welcome, Dr. Elaine. Tell us a little bit about yourself and how are you?
yes, thank you so much for having me. I come from Maryland. We're here in Portland, Oregon for the Denobi Award.
Yeah.
And I'm 33. I've been practicing in Glen Burnie with my dad for the past 8 years.
That's great.
And outside of dentistry, me and dad actually race cars together. And so that's kind of my hobby outside of.
Are you ever repetitive outside of dentistry at all?
He's so much better at me than driving. I'm just trying to get up to his level. So I've only been doing it for a few years. He's been doing it.
Well, if you ever want to practice, you can come to New York City and you can practice in some of the roads. It'll teach you really. And it really teaches you a lot about work rate. Let me ask you something. What inspired an Elaine Bylis to go into dentistry? Was it always in the family discussion at dinner? Go into that.
Let me tell you all about it. So there's really, I think, two answers to this question. So the first answer, I would say, is the more obvious answer, that when I was growing up, I would spend a lot of time in the dental practice. And my dad is one of the most talented clinicians I have ever seen. And he's what we would consider a super GP. And so he's doing all different kinds of procedures. And I would go to the office and I would be helping out, but I would also watch the transformations that he would create. And it wasn't just making someone look beautiful, but I would actually notice the change in personality, the confidence, and people would become their true selves when they got their perfect smile, and also their function was better. And so I decided from a young age that I wanted to be able to create that kind of change in other people. And so that's kind of the first answer.
Yep.
But then there is a part two.
Okay.
Yeah.
Give me the guts.
But it was funny because I started working at his practice when I was 11 or 12 years old.
Sure.
Doing just whatever needed to be done. So I was developing x-rays because there were film x-rays at the time.
Awesome.
I would file charts. I would suction, whatever they needed me to do. I was there helping out. I wasn't doing it for pay. I was just doing it because I just loved being around the dental office. So I knew dentistry was a path for me. However, my mom, before she became our office manager, was 25 years as a software engineer for Verizon.
Wow.
And so there was another part of me that thought, well, maybe I should be a software engineer. And I had this amazing MySpace. I was obsessed with coding it and making it like the coolest MySpace. Remember that when we would make these amazing pages? And so I had the coolest MySpace ever. So I thought I was going to be a software engineer. And so for Take Your Child to Work Day in 7th grade, instead of going with dad, because I had spent so much time at his practice, I went with mom. And I sat in her cubicle for 8 hours. And that was the day I knew I had to be a dentist.
There you go. That's
And
great.
so from then, so starting in 7th grade, when people would ask me, what do you want to do? I would tell them, I'm going to be a dentist.
So let me ask you, you touched on it. And for those of you that don't know, I talk about it a lot. So I talk about it a lot. I have a third-year dental student, and he's coming out in a couple of years. I would love for him to come into whatever I'm involved in clinically and be really part of it, but he's going to have to make his own decision. So was it just a definite that you were just destined to take over Dr. Flo Bylis's practice?
Amazing question. So I'm going to preface this by my parents never pushed me to go into dentistry. So dad actually told me, he was like, do not do this because of me.
Right.
Do dentistry because you want to do it. And his little quote is, dentistry is a very hard way to make a living. And so when I come home, and so I did it because I want to do it. When I come home and I'm just like completely exhausted and I had some tough extraction and then whatever it is, he goes, I told you, you picked a hard way to make a living. And so we know that if I became a dentist, I would be joining the practice. I never considered like going off and going elsewhere.
So was he, now we're getting in, we spoke before about procedurally, and I'm going to get into that in a little bit. But as you come on, he's got his ways. He's a super generalist. Which means, for those of you who don't know, let's relate it to the HMSA, right? The dental HMSA is doing all 5 procedures. He does it. Now, we talked about understanding comprehensive treatment planning. So has he been just the best mentor for you? Because you come in, and this is gearing up towards this talk about succession, which is the buzzword about a lot of things. But in my opinion, you being able to do all 5 things and being a comprehensive treatment planner makes you a great producer.
Yes.
Have you and your father discussed that? And that is the path that you're really taking on.
Yes. And so one thing that I tell all new grads is you have to have a mentor. I am so lucky. So it could be a residency, it can be the practice owner that you join, it could be anything, but you have to have someone who's guiding you, because when we finish school, I don't care who you are, what practice you grew up in, you have no clue what you're doing. You need someone to shape you.
Absolutely.
And so by joining my dad, I had that personal mentor. And even I'm so glad that I had him, because he saw something in me and he pushed me to do procedures. So he had me placing implants my first year out. And so he really pushed me to do procedures that maybe I didn't even necessarily want to do, that now I enjoy because I'm good at them. But he gave me that little extra nudge in the right direction to head toward super GP myself.
Awesome.
Yeah.
So before we get into the bottom half of the palm and we talk about finances, it's interesting that, you say that he is one of the finest dentists or GPs, dentists you've seen his work. Wow. How lucky are you? You have a mentor, a father, and a practice leader that you could really believe. I mean, it's much more difficult if you come in and see open margins, recurrent decay.
Yeah.
That must be, I was just thinking about it, could you imagine working for your family and seeing the worst dentistry? And now you got to go to your family and say, I'm out, or I'm going to be redoing all the work. But that must have been like a no-brainer to go into the practice, knowing he does such beautiful work. I read his reviews. They're spectacular. I mean, you've got what it sounds like is a great family practice. And before we move on, I understand your mother is now running the show.
Yes.
So she's the office manager. So it's really a family. You have corporate dinners corporate meetings over dinner.
Yeah.
And, really a deep dive. So do you find that's a growth? Are you nervous about that in the future? Or do you think about that a lot? So what comes up with that? Tell me, I'm curious, because you have parents that are running your professional life and God willing, they want to go off to travel the world. What are you feeling?
Yes. Thank you for asking. Yes. So right now I'm in a perfect situation where I don't need to do all of the kind of behind the scenes, the business things yet. And I know it's coming, and where I'm going to have to be in charge of the business side of things as well as the clinical side of things. And it's a weakness of mine that I don't have a ton of business training. And so I try and meet people like you and other amazing business minds in the field who can kind of give me tips and tricks, because eventually that will become mine.
Yeah.
And
each doctor I find has a different flow. We all did.
Yeah.
Okay. Maybe I was running my practice at the same time I'm talking treatment. I always try to just focus on the patient in front of me, right? But then everything else is going to wait a minute, but I'm going to deal with it while the patient's numbing and everything like that. Here you have, I mean, your team, which is very close to you, is insulating you from that. But as you mentioned, you're 33.
Yeah.
And in 5-6 years, they're going to be hopefully enjoying life somewhere really beautiful, and you're going to be running this business. So, you know, and we've established Dr. Bylis, Elaine Bylis, is a very passionate, very ambitious professional. And do you foresee this? Is there guidance? I mean, we're going to get now into this succession discussion, and we've talked about this a lot. And I think about it. I think this is the most important thing in dentistry right now. We talk about AI, we talk about, technology and implant training, but we have to have hundreds, thousands, tens of thousands of dentists that are going to the next stage, whether it be retirement, lecturing, traveling, podcasting, advising companies, whatever it is. Young, phenomenal dentists like you are going to come up. And what is your biggest, in your mind? Is it the finances, or what is it in your mind?
So there's two things that I think I'm the most, quote, nervous about being completely in charge of. I try and do as much as I can right now to kind of learn my way around these. But thing number one is finances, managing the books. And thing number two is finding great members of our team. We have amazing retention because you have such an amazing practice. So we have ladies who have been with us for 20, 30 years, but eventually they're going to need to retire. And so that's going to be on me in terms of finding the next personnel to take their place.
And how do you feel like you're ready for this? I mean, is this something you and your folks talk about and getting you ready? I mean, is it going to be hiring a manager? Is it going to be hiring a partner? What about you and your these are all questions, right? So what I feel is, in the succession way of life, I call it, and maybe you and your dad on the clinical side call it, and this is a new term that I think is really the way that offices have to look at succession. And I call it procedurally matching, because if you're all doing implants and none of you like root canals, it sort of like loses the flavor of being a super generalist, because we're spending time on surgery, but we're referring out 14 root canals a month. So my question is, these are discussions I have with my associates that come into practices that the doctor doesn't do implants, doesn't do root canals. It's a great opportunity for them to pick up all those patients and then from there grow their book and then take over. Is that something you guys thought about, or you're now thinking about? I mean, obviously your father's probably not talking about retiring right now. And if he is, the flip side of that will be my next question. But first we'll do procedures. Have you mapped out of procedural matching to the practice, or just learn everything, which is also another thing, and just take over everything he's doing?
That's exactly what we're doing. And so we do every procedure. We do implants, root canals, gum surgery, osseous crown lengthening, all different types of cosmetics, both composite and porcelain veneers. But we also do like fillings, and our practice is hygiene. People think of us as a cosmetic practice, but we are a general dentistry practice. But part of me joining, and I think part of why I've been a really good match for my dad, is because I'm able to do all of those different procedures. There's nothing that walks in that I feel like I can't handle. Yeah.
What a great aspect to have now. Early on, you're almost years out of your program, out of school, and you're doing everything. And I think, I have an associate in New York that's been with me for a long time, and he's about 5 years ahead of you. He produces crazy amount. It's because early on we bought into the dental HMSA, the 5 procedures. And one thing people do is they lose sight of the finances, because they're in a practice and they let me oversee it or deal with it. And if he has an issue with his pay. But my question is, as a senior doc, and I just saw this yesterday, I went to see a doctor in downtown Tribeca, New York, and here we are in Portland. So thank God for airplanes. But I had a long discussion with him. The practice is doing about a couple of $1 million, $2.5 million. And he's a slightly older guy, and he's not sure he wants to sell.
Mm.
Him and his wife were there, and his wife is an acupuncturist in the practice. And I say this because, he says to me, "What do you think? Should a DPO, a guardian, or somebody interested in buying buy?" I said, "You know what, Fred? I really think you're looking for an associate,
Mm-hmm.
somebody who can pay you an annuity, somebody who is going to either buy you out, which means pay you up front and let you go away, or just slowly over time pay you every month for the next 15 years a certain amount of money. That's a built-in annuity." So my point here is that if it was me and I have one practice, I built it to a great heights. I don't know the arrangement. You're in Paul Bylis, you're his daughter who's just aspiring to be a phenomenal dentist.
Mm-hmm.
I'd hand you the keys. But in this aspect, I want the listeners to understand the difference between a buyout and an annuity, because we had this discussion. So you guys have never put this into a conversation
Mm-mm.
because you trust your dad and he
Yeah.
trusts you. But in other aspects, when a doctor is taking over a practice, that doctor, like the one in downtown Manhattan, has to understand what he's really looking for is a future to just enjoy life. And sometimes having somebody pay you over time, like if my son comes in, I hand him a couple of offices, I would like him to pay me over time. So our family has an annuity that we're just taking care of for the rest of our lives, and we don't have to worry about a thing.
Yeah.
So this is what I think dentistry is giving us today, is the groups are there for a buyout. The young, phenomenal super generalists are there for an annuity. And it sounds like the Bylises have that.
Yeah.
Do you feel the weakest part for you is the finances? And is that right? We want to know percentages. And as you grow this practice,
Mm-hmm.
you might be the one in to deal with the DSOs or DPOs.
Yep.
Have you ever thought of that? I mean, or right now you're just focused on building this practice to the best you can do. Okay. So what procedures are you looking at in your office to bring on? Is there anything that would, comes to mind first and foremost?
So we do just about everything.
You just sleep?
We don't do
No.
sleep.
Isn't that interesting?
And I took the training on it.
Yeah, we all did.
I know how to make the appliance, but it doesn't bring me joy. And we have a specialist who practices nearby. He does a great sleep appliance. He actually made one for my brother. So when I do the sleep appliances, I need a lot of adjustments, and it works eventually, but it's not as pretty as when Dr. Mugford does it for my brother. It was instant. My brother's sleep went beautifully. But I also think that every dentist should be trained on sleep. Even if you're not doing sleep, we should all understand airway and sleep and nasal breathing and all of the effect and arch width and airway and all of those things and how it impacts overall health and dental health.
Question.
Yeah.
With the advent of technology, you're coming into an office has your father accepted? Has the senior doc accepted? Or have you moved to more technologically advanced? Are you dealing with AI on the phone? Are you scanning? Are you putting, surgical guides in and having a printer?
Mm-hmm.
Are you moving towards that?
I love this question. So I am very fortunate, and I think that other owner docs should take note from what my dad did. So my dad, he was trained in the 80s. He's not familiar necessarily with technology. He's good enough with computers.
A crime being trained in the 80s.
Yeah, no. Oh my gosh. But he is
Great treatment planner.
Yeah.
There you go.
Oh my God. And so talented.
Exactly.
Unbelievable. It's just, he wasn't trained when there were computers around. And so he can get by on the computer. He knows how to use a computer, but he's not totally into tech savvy.
Right.
Exactly. So when I came out, the minute I joined the practice, he started investing in technology, not for himself, but for me. And really, it did come back to benefit him so the first big purchase that we made when I finished school, we went straight to the trade shows looking at CBCTs. It was our first big purchase. I'm going to tell you right now, we have to set the whole thing up for him in order for him to be able to read the CT. He doesn't know the technology as well as I do, or our assistant Jen, but he knows what everything means. It just has to be set up in a way where you can see with the
Well, now he can get one of the AI programs and he can color code so we can use that. But that's really great. Kudos to him for really acknowledging the growth that you're going to bring, and also the foresight for what's coming down the road.
Yeah.
Because I feel that that's something that's a big drawback to families. And what I mean by that is, if you're an older doc and your child comes in, you're not being pressured for retentive purposes to hold on to technology, to advance to nicer equipment.
Yes.
But to your father's credit, he knew that he needed to advance that.
Yes.
And we need, as practice owners, to advance that because we want to have the latest and greatest in order to keep the best and the brightest.
Yes.
We have really 80s material, 80s equipment. We're not going to get an Elaine Bylis to work for us. So I think that's major. Anything else you want to add that maybe we haven't discussed that you feel was something that really out there, when you first came on to a family practice, some things that were a little more difficult, maybe you didn't have, you really wanted to please, you felt it wasn't as easy as everybody thinks it is, those you're dealing. So tell me about that.
Great question. I think something that I don't hear anyone else talking about, but I'm here to give permission to feel this way is for me, and this is something that my dad told me right when I started, but I didn't really hear from anyone else. And what he told me is it takes 5 years to become completely comfortable. And so it is okay.
Great point, everybody. That's amazing point.
It is okay to not know all the answers. The most important thing is you go to your mentor, you go ask for help. And so, but it was kind of crazy. The day it was year 5, I was like, oh, I can handle everything. I don't know what it is that something flipped. But my first year out, I mean, I wanted my dad to be there in person, not because he had to see patients, but just because if I ran into something that I wasn't sure about, I wanted to be able to bounce ideas off of him. And so just take it slow those first 5 years. We're not in any rush. I think hand skills come from just doing things and taking things slow versus trying to just do quick and maybe sloppy work because you're rushing. And so take it slow. Give yourself 5 years, and then all of a sudden, it just becomes comfortable.
I'm going to tell you, that's such a great point, Doc. It's such a great point because I think the most important thing for people to come out, dentists to come out, whether you do a program after or not, is to really focus on your skills.
Yeah.
And those 5, 6, 7 years of becoming that super generalist that you've become is such a credit to you that you've really been able, and a credit to your family. Because they wanted to make you that, you help you get that, not make you that, but help you attain that knowledge. And they knew that it was going to be a process.
Yeah.
And too many people are jumping. I had somebody that I really looked up to. I don't know if he was a mentor or not, but I rented space from him in New York, and I really was eager to grow. And he used to say, Mark, you want a practice that's 10 years old? You got to be in practice for 10 years because nothing substitutes experience. And you're seeing that. And how lucky are you to have such a great mentor built in? And, all the numbers we talk about, the marketing, the staff, the payroll, there are ways you're going to learn that. That is going to come to you. It is not rocket science. These are the things to run your business. I just strongly advise young dentists in a position to have a great practice to take over, whether it's family or not, is learn everything.
Yeah.
Because as we spoke about once, we want to know what people are putting into our PMS, into our management software. We want to know the monies. It just safeguards everything that they think that we know more than we actually do. And then one day, just like the 5 procedures on the HMSA, you're going to get that financial understanding.
Yeah.
And then we talk about that efficiency, sustainability, work-life balance, and then you're going to have a great exit. And I think you're on the path to just an amazing career. Early on, you have wonderful procedures, and I'm so happy you joined us. I really am.
Yeah.
I want to tell everybody this was a joy because Dr. Bylis is exactly what we look for in any practice we have, both in Guardian and anywhere else I would advise anybody. So you're a real star. I really thank you for coming on. I want to say good luck tonight at the Denobi Awards, but I'm not because I'm a competitive guy. But I wish you the best.
Thank you so much.
If I don't get it, what do you do better? Look up Dr. Elaine Bylis. She's in Maryland, and she's wonderful and bubbly and so knowledgeable. Those terrapins turn out good dentists. I'm Dr. Marc Liechtung. This fit right into the dental HMSA of just understanding your finances, but understanding the importance of those procedures makes you such a great treatment planner and allows you to go into the next phase of your career. And maybe that means taking over a practice, adding more procedural matching to a practice. Who knows? Sky's the limit once you have that education. Thank you so much for joining us.
Thank you so much for
It's
having me.
great.
What an honor. Thank you.
Thank you, everybody. We'll see you at the next episode of Dentistry Beyond the Numbers. So, what a great discussion with Dr. Elaine Bylis. What a fire plug. She reminds me of so many great associates I've had through my career, and what a great future. But the most impressive to me is how she understands the dental hamsa, the ability for all 5 procedures. She even said it herself, super generalist. It's what her and her dad are grooming her, are guiding her towards. To me, that's amazing, because comprehensive care and comprehensive treatment planning is everything. Now, you could see where we're in a practice and she has to get better at finances, understanding her business. She knows that. She's getting her procedures done for procedurally matching the ability for her to explode her practice, even if her father takes a little, or the lead doctor takes a little break. I think this is exactly what we're trying to convey. The future of dentistry is going to be held, in my opinion, with super generalists, and the specialties are going to do specialty work. Dr. Elaine Bylis is exemplary of that. And I'm so happy we're able to have her on. We have some great shows coming up. Howard Ferran, Mr. Chuck Cohn, Dr. Christensen, Bill Gordon Christensen, Kim Cooch, Dr. Elaine Bylis. We have Colin Carr, all about real estate. Tim McNeely, all about financing. It's amazing. But the goal is to get you, the clinician, and the listener to be so well-rounded that this profession is fun. That was a guest that makes it fun. So happy to give it to you. So happy to bring it to you. Dr. Marc Liechtung. See you next time. Dentistry Beyond the Numbers.